Welcome to the Cervical Cancer Survivor Series. I'm Martha Kempner with the American Sexual Health Association and the National Cervical Cancer Coalition. We recently reached out to survivors across the country to hear their stories of diagnosis, treatment, and survivorship, and get their advice for others whose lives are impacted by this preventable disease. We also talked to providers in the field to answer questions about screening, prevention, and treatment. In this episode, we speak to Aisha McClellan. Aisha went to a clinic with symptoms and was sent home with antibiotics for an STD she didn't have. It took 3 visits before she was diagnosed with cervical cancer. Aisha had to be her own advocate for healthcare, which inspired her to become an advocate on TikTok, where she has over 25,000 followers. Thank you so much for coming. Can you introduce yourself?
So my name is Aisha. I'm a 7-year stage 4 cervical cancer survivor and turned patient advocate. I use my TikTok platform to educate the public about signs and symptoms of cervical cancer and share bits and pieces of my story just to help empower others to learn how to advocate for themselves.
Well, we really want to hear your story today. So I think we should just start at the beginning. How did you find out that you had cervical cancer?
Yeah, so in May of 2016, I was just having some weird symptoms that didn't sit right with me. I was having some irregular bleeding, and it happened twice after, is it okay to say sex?
It's encouraged to say sex.
Okay.
Please.
Okay. All right. So, after sex twice, I had noticed that I had bled. Um, it was like a bright red blood, and it just kind of weirded me out. It felt different than, period blood or anything along those lines. And so after the second time, I went to the doctor to see what was going on. They basically told me that it seemed like I had some sort of STI, and they just gave me some antibiotics and sent me on my way. There was no further testing at that time.
They didn't tell you what STI you had?
No, they just said, you probably have an STI. And yeah, they just said, take these antibiotics. And so then I think the next step, this was before I'd gotten any sort of STI testing. And so I went back a second time and I was like, I'm still having some bleeding. And they were like, you need to let the antibiotics run its course. It was like a 10-day course. And so then at that point, they did like an STI screening. I was saying to them that like I felt like there was something more. I'd been with a partner for a long time. I didn't know how trustworthy he was, but I just, I didn't think that this was that. I just felt sick. So I went home, and this next week that I was at home, I started having more symptoms that, I was pretty fatigued. A friend of mine looked at me one day and said that I looked like gray. I'm a single mother of 3 and I have a pretty high energy level. So I noticed there was something totally off. And then the bleeding had happened again. So I finally went back to the doctor and I was like, I think we need to do like a thorough check. I think something is wrong. I don't know if they were short, I believe they were short staffed at the time. And maybe that's why my care wasn't, uh,
As thorough.
yeah, as thorough. Okay. So they finally did a more thorough check. At first, they didn't really see anything. And so they had to bring somebody else in because I guess it was kind of hard to see exactly what was going on because it was so inflamed. And then another doctor came in, and that's when they saw what they thought was a mass. And so they said that I needed to get a biopsy, but that they couldn't help me with that part. So the next step for me was to try to find somebody to give me a biopsy with no health insurance at the time.
Where were you getting this care? Because it sounds like it's a little alarming to hear that you went in with symptoms and it wasn't until your third visit that you were actually
Mhm.
given a pelvic exam.
Yeah, so this was just the local health department. This was like just a local community center, community clinic. No knock on them or anything. I don't know. I think this happens far too much, and I think that we need to just bring more awareness because a lot of people are dismissed for these symptoms in particular. And I think it happens, at small rural community centers and larger institutions as well. So
I think the thing that is great to emphasize is that you didn't give up. You didn't just say,
Right.
okay, they must be right. It must be no big deal. You kind of listened to your body and took the signs and kept looking for answers.
And that's a big reason why I advocate today, because had I just left that first time and not come back, I don't know how far it could have gotten. So I finally got a biopsy and they determined that it was cervical cancer. So then I had to go get it staged. So it was stage 2B. It was into out of my cervix into like the perimetrium. And that would explain why it wasn't initially seen because it was just it was far back.
Mhm.
So, pretty immediately, I had to go into treatment. I did 25 rounds of radiation, 6 rounds of chemo, and then I did 5 rounds of internal radiation. I did that over a course of 3 months. During that time, I had lost my job because they said that I couldn't work during treatment, I guess essentially because I was having chemo once a week and radiation every single day.
I'm sorry, who told you you couldn't work? Your job or the
My doctor. Yeah, he said that I couldn't work for 3 months. I was working for a small company at the time and didn't have any benefits, and they just couldn't afford to pay me. That was really difficult. I completed treatment in August of 2016, and they said I had a good response to treatment. Everything looked good. And the next step was to come back in November for a follow-up. During that time, I just worked on really trying to get well, and I got a new job with my local university, which was great because I would have benefits now. But so 10 days after I started
can
my
I
new
pause you
job,
for 1 second?
yeah,
I want to just talk about the treatment because we've talked to a
mhm,
couple other people who had internal radiation. Um,
yeah,
what were the side effects of a treatment like that, and how difficult were those 3 months?
it was rough. Because the thing about it is like I didn't know what to expect. They're just like, you think chemo, you think super sickly, you're bald, you lose everything, blah, blah, blah. And so, like, but this particular chemo didn't cause you to lose your hair or anything like that. And so, from the exterior, I looked like relatively normal, but I was so fatigued. That was just, I was telling a friend the other day, I couldn't even walk up a step. I had to like walk up a step and take a break and walk up another step. It took me like 30 minutes. I lived on like a third level apartment. Just to be able to walk up the stairs was exhausting. I had to use a stool when I did dishes. The fatigue was so overpowering. And then as far as the brachytherapy, the internal radiation goes, I didn't know what to expect. I didn't do my due diligence when it came to like learning about my treatment. I was just like, I have cancer. Let's do what we got to do and get rid of this thing. I didn't even stop to think about what it was going to do to my body. And so breaking the internal radiation, basically they sedate you when because they're trying to get as close to the cancer in the cervix as possible. I didn't realize it was that kind of procedure because external radiation, you're just, laying on a bed and the beams are giving you the radiation, but this is more of like an invasive procedure. And I didn't really, it kind of felt like if you've ever had like an outpatient surgical procedure.
How many procedures did you need?
5. So I had to have 5 of those. So you go in, they sedate you, they insert the poles, and then they give the radiation right in this concentrated area. And they do a CT scan right before, so they know exactly where to place the rods. And then you have to, you wait after the procedure. If you're under any anesthesia, they want to make sure that you're okay. And then you have to kind of get wheeled out. Being that I didn't really know what to expect, the first procedure just kind of caught me off guard.
And did your provider tell you? Did anyone on the care team explain it to you?
I don't know if I was so caught up in like what was happening that I wasn't able to retain the information because
Mhm.
I was going to all of these appointments by myself and I was stressed and I was scared. And so I don't know if part of it is me not really understanding or, hearing what was happening versus them explaining it to me.
Mhm.
But my understanding of this, I didn't even know that this was standard of care. I thought that this was like a clinical trial, like they were trying to figure this out. like I said, I don't know if that's a reflection of me not understanding or them not explaining thoroughly, but
I think care providers should understand that it's a lot to take in and
yeah,
to take time to help you understand it.
exactly, exactly.
So did you have side effects from them, especially if you're willing to talk about it, vaginal side effects and sexual side effects?
So I wasn't sexually active during this time. Honestly, if you have like a metal rod being inserted in you and having radiation into that rod, it doesn't really, make you feel super sexual. But I did have like a lot of irritation from that. And so like every night I would have to take an oatmeal bath to kind of soothe myself. And also, I had like a lot of bowel issues because I would either be constipated or would have diarrhea. And so then, as a result of that, I would have like, I developed like hemorrhoids. And so then I had like anxiety about using the bathroom. And so every night, between like the brachytherapy side effects and then the side effects of the bowel side effects of, the chemo and radiation, I mean, I felt pretty horrible, honestly. And so I would have to like take this oatmeal bath just to try to like soothe myself. And I would have to use like topical creams because I would have like radiation burns.
External radiation burns? Like on
Both. Yeah, both.
wow.
I think more so external. I think like there was just pelvic pain overall. I don't know if it was a result of, yeah, I mean, I don't know if the pelvic pain was a result of the radiation or the treatment. I'm not sure, but I had like pelvic pain and I did have like radiation burns because I was getting radiation to my whole abdomen area. So yeah, it was kind of a combination of both.
You had mentioned that when you first were diagnosed, you didn't have any health insurance.
Right.
Were you able to get health insurance?
Yeah, so I applied for Social Security disability. And so I ended up getting, I believe at one point I had Medicaid and then I had like Medicare.
But there were resources available for you once you were diagnosed.
Yeah, once I was diagnosed, I think I applied for like emergency, like Medicaid or something like that. And so I had coverage. And it was also supplementing my income since I had lost my job.
Right? And you had three kids.
3 kids.
What
Yes.
was what was it like to be doing all of this? Did you have support around you? Did you have family and friends?
Not really. I am very much a single mother. I don't have much family. My mother wasn't able to help out much at the time. And so it was kind of all on me. I did have friends that would do minimal things, Some people would try to bring me food as they could, or, maybe pick up my kids here and there. I'd say 90% of it was just me. And it was really, really hard. Looking back, I don't know how I was able to do it.
Just before we get back to your story, what advice would you give for the friends and family that are around someone who has been recently diagnosed or who's going through treatment? What could we all do to help the most?
I would say don't ask because for me, like, and for a lot of people, we don't want to feel like a burden. We don't want to feel like we're asking you to overextend yourself. So think about things that you can do that you don't have to like ask permission to. Like everybody needs a warm meal, like bring dinner or bring support or just share ways that you want to help on your own without having to ask that permission. Because I think a lot of times people might have asked me, but I didn't want to seem like anybody else's burden. If it's okay, like just go by and check on them or bring them some dinner or offer to help them in ways that they might not normally ask you. Laundry,
Laundry.
cleaning, all of those things. It's all needed and helpful. And we try to take all of this on ourselves, but it's not sustainable.
So you said that you went for a
Hmm.
follow-up scan.
Yeah, so
What
I went
happened
for a
then?
follow-up scan in November, so that was 3 months later. Again, going back to the fact that I didn't really research as well as I should have what to expect or anything. I didn't have any sort of anxiety about this appointment. I thought this was just like, they're gonna tell me I'm still good. I didn't have any symptoms. I didn't really feel, I mean, I did have some sort of like side effects from treatment, but I thought it was just that, I thought I was just recovering from all the treatment. I go in and, my normal doctor wasn't in there, his resident was in there, and I just remember him looking so like stoic and sad, and I'm just like nervously chatting, and he was basically like, I hate to tell you this, but your cancer has spread to your lungs. I was confused because I'm like, do I have lung cancer now? Wow, like, of course, I have like a second cancer. And then he's like, no, he had to explain to me like what a metastasis was. And then he explained that it had spread to like my lungs, liver, and lymph nodes. And like, I guess at this point, I would be considered stage 4B because it's a distant metastasis. Then my normal doctor comes in, and they're both just so sad, and just I'm still not really, it's not really registering how serious it is. I'm just like, in my solution oriented mind, I'm like, okay, more cancer, okay, more treatment, we'll do it, I'll be fine. Then they were basically like, yeah, no, once your cancer spreads, once it metastasizes, it becomes a lot harder to treat and control, and nothing we can do will be essentially curative. Then I ask, the question, what are we looking at? It's starting to register how serious it is. And so now I'm like, well, what do you mean? Like, am I gonna die? Like, what are we thinking here? And he was like, it's hard to say, but like I said, any treatment we do is just going to try to keep the cancer at bay, but we can't get rid of it. And so you're looking at, minimum 6 months. And then I was like, oh, that's without treatment, obviously. He's like, no, like if you don't get treatment, you probably have about 3 months. It's just crazy just thinking about that, just sitting there, just like going into that appointment, just like not even, I didn't even think that was remotely possible what would happen, like it was the day after election day, like that was all the talk. I was all absorbed in that. I was up late watching, poll results. Like I took pictures when I was coming in of like the nostalgia of like coming to the coming to this hospital again. And so I just felt like I had been beat up. I was flabbergasted. And then, like, immediately, I just couldn't think of anything but my children. Like, I have 90 days left with my kids. Like, what? What? Yeah, it was pretty mind blowing.
So were they suggesting not to do treatment?
So he basically said that this treatment regimen that he would put me on is palliative. It'll keep me alive for a few months potentially, but I would need to think about the quality of my life and what I would want that to look like. Do you want to go on this treatment that's going to drastically decrease your quality of life, or do you want to opt out of treatment, and maybe enjoy this last little bit of time you have with your children, and go from there.
It's a horrifying decision to be given.
Yeah. And I mean, it was like, to me, it's like a no-brainer. If this treatment can keep me alive, even if it's 91 days that I have with my kids, I'll take that extra day, or I'll take that extra time, even if I feel like crap, because I didn't have anybody else to take care of my kids in the event that I passed away. And so I had to be here. I lost it. I couldn't leave the doctor's office for a couple hours. I was just in excruciating pain. Like my heart just broke. And my oncology nurse came in, and she sat with me, and she cried with me, and she helped me process it. And it was devastating. And then she walked me all the way to my car, and I literally had to go from getting this devastating news to go picking up my kids from after school. Yeah, I mean, I got in the car and I cried some more, and I made a call to somebody that I would trust in the event that I did pass away, and just because the first thing I'm thinking is like I said, not about the cancer, not what it's doing to me, but I need to like get my ducks in a row in case I do pass away and make sure that there's somebody to take care of my kids. So I made that call. Ugh, like the hardest call of my life.
How old were your kids at the time?
8, 9, and 10.
Oh, wow.
Yeah. And I got off of that call and and that's when I literally made a decision at that moment that I wasn't gonna die. Like I just was like, I can't do this. Nobody else is gonna like love my kids the way I do. Nobody's gonna, care for them the way I do. And been doing this by myself all these years. Like this is me. This is I can't leave them. Yeah, making that call literally just fueled something in me that I didn't even know existed. Since I just started this new job at the university, I decided to use my email address to my advantage, and I reached out to every oncologist at the institution, no matter what they specialized in, just to have somebody take a second look. And the director of gynecologic oncology emailed me back personally. She basically looked at the scan and agreed with the findings that yes, it has metastasized, yes. But she said something very different. And she just said that, you're 32, you're young. I think that you could handle treatment. And I think that we should try. And, we don't know what's possible. She wasn't blowing smoke. She wasn't making any false promises. She was just saying, like, let's try.
Very different attitude.
Very different. And I will say, the oncologist that diagnosed me, he was a radiation oncologist. They're not really participating in this same sort of research, and they're not a gyn-onc. And so his scope was probably very different than what a gyn-onc would have said, potentially. I don't know. Just trying to give him the benefit of the doubt. But yeah, so that gave me hope. And so from there, I just kind of like turned a corner. I just led from a place of hope versus fear. And I started, instead of like Googling all the bad things, I'm like, I wanted to find one person who had survived it. And if there was one, there could be two. And so I searched high and low just to try to find at least one person who had survived it. And I mean, I looked everywhere, all the social medias. And then I went to GoFundMe and I researched this girl and, found out that there was somebody who had survived this same particular cancer and stage and spread to the same places. And she was a year in remission. I was like, if she can do it, I can do it. And I just led from that place.
So how long was this second round of treatment?
So the second round of treatment was 6 months.
Wow.
It was a combination of 3 different treatments at the same time. So I would have to go in for an infusion once a week. The infusion was 8 hours at a time. Yeah, I did 1 week on and 3 weeks off. The 3 weeks off, I just tried to keep life as normal as possible. I wanted to show up for my kids. I wanted to, you know, it was around like they were doing different things in school and I wanted to make sure I showed up. And so and then I just got this new job. And so I wanted to be there. I didn't have time to take off or, I didn't qualify for FMLA. I was able to kind of push through these hard moments. One, because I had no choice. But two, because I wanted to. I wanted to give my kids as much normalcy as I could. I hadn't had the greatest childhood, and my objective in life was to just always give them a better life than what I had. And I stayed true to that. I lost all my hair and everything. And, image is very important to kids just in general, but around these middle school age times. And so I didn't want them to be treated differently because their mom looked differently or anything. And so I would throw in a wig and a baseball cap and I would go show up to all the games and all the events and all the things. And honestly, pushing forward and not really having a choice not to, I feel like ultimately was one of the biggest things that saved my life because I didn't have an opportunity to succumb to any of the pain or the emotional turmoil or anything because I just had to push through for them all day. I did take my time. I would cry when I went to bed, but I put on a smiling face throughout the day.
So after 6 months, what happened?
After 6 months, I did a CT scan And my doctor said, I had a really good response to treatment and there was still a bit left in my lung. And so she was going to refer me to a cyberknife therapy, which was just, well, she was going to refer me to more localized radiation. So she referred me to a radiation oncologist, and she wanted to do a PET scan to get a really good idea of where the cancer was left, how much cancer was left. It's just a better measurement. She gave me a call a day later, and she said that she had never seen this in her entire career of like 25 years, and that what was left on the scan was actually calcified tissue. And as a result, yeah, she said that I had had a complete response to treatment.
You didn't actually have cancer in your lungs anymore.
No, no.
So have you been disease free since that time?
I've been disease free since August 10th of 2017.
Congratulations.
Thank you.
This is a kind of hard question, but you've been so open with us. What does it feel like to go from being told you have 90 days to, we're now 7 years later?
Well, there's been waves. So like at first, I kind of felt like, I don't know, I was like living on borrowed time and I like cheated death in some way. And so like a lot of times I felt like just waiting for the other shoe to drop, especially when you're referred to like as an anomaly. It's cool, but also like I don't really want to be like the lone ranger here. So for a while it was really hard. Like I wanted to enjoy my life, and on one hand I was so happy that this had happened, but then I didn't really feel settled and it was really hard. And so I just pledged to make the most of my life and try to be just an overall happier person, and I learned how to embrace these hard moments. And there's been waves. Like initially it was a lot of fear. Then it became just, I became more at peace with like my life. From there, I allowed all of that to just fuel me into advocacy and helping other people. And I don't know if I'm disconnected from my diagnosis to an extent, but I'm at a place in my life and with my diagnosis where I can pour my energy into other people and help them navigate and understand that I had to have this experience in order to help people in the way that I do. So I now am at a place of like appreciation for everything that I've gone through, because it's allowed me to, have these sorts of conversations, or share my experience on social media or TikTok. And I consistently educate myself on my diagnosis and treatments, and I try to stay up to date. And so I feel comfortable that, God forbid, it ever returns, I have so much more knowledge now, and there's so much more treatment options now. And so I feel finally like at a place of peace.
Can you tell us what kind of advocacy work you've been doing?
Yeah, so I have been doing a bit of everything. Like I said, I share my story on TikTok. Any opportunity I get, I try to share my story. And I have been so vocal about it that people have reached out to me personally to talk to me about their journey and ask questions about, just get guidance on what they should do next. I have been invited to speak on panels and give my patient perspective. I participate in several advisory boards where I do anything from, looking at reviewing a grant to make sure that it's easily digestible for patients and they can understand what they're signing. And I participated in like a young adult advisory board where we helped restructure a chemo room and for young adults so they can have, just a warmer and more inviting space. So that was a really cool thing that I've done. I created this journal to help people when they're diagnosed with cancer be able to navigate the process a little bit better, kind of everything I wish I would have known. And I just compiled that into a journal planner that I sell to patients. And yeah,
What are some of the things that you wish you'd known?
gosh. I wish I would have known like the importance of just writing things down in general. You're just thrown so much information. This is a very foreign experience, and just taking time to like stop and and write things down and learn about what's happening is one of the biggest things I wish I would have done. Writing down questions to ask your doctor, make you don't have a lot of time with your provider, and so you want to make good use of that time. And I remember I'd go in and I would just be so nervous about what they're going to say. I would think of all these things I wanted to ask before I got there, and then like my brain would just turn to mush. So just, questions to ask your doctor, just finding the importance of like gratitude and taking care of yourself. And even in moments where you can't figure out what to be grateful for or how to be grateful, or trying to look for the good things really helped me process the not so good things. So yeah.
And did you tell me that you also changed careers because of this?
I did. At the university I was working at, I just looked for more cancer specific positions. So I started working with a cancer outcomes group. And so I really try to delve into as much like patient advocacy stuff, and lend my patient perspective as much as possible. I want to continue to find roles that support that. And I had to figure that out. I wasn't sure at first if I could really immerse myself in this cancer world and not be triggered consistently. And I have finally gotten to a place where I feel that it's now turned into my purpose. So I plan to continue to try to find roles that align with patient care.
Thank you so much for telling us your story. It's really an incredible story. And I think the incredible strength that you showed both in advocating for yourself for the initial diagnosis and then just, getting the second opinion. It's really incredible. So thank you.
Thank you.
Thank you so much for listening. If you want to listen to all episodes in our cervical cancer survivor series, head to nccc-online.org, where you can also find a lot of information about cervical cancer prevention and screening.